New information has come to light that Planned Parenthood is quickly becoming the United States' leading provider of gender transitioning hormones for young adults. Jennifer Block, the journalist who broke this story, will be joining me in today's report to talk about it. Drea Humphrey here with Rebel News, where we tell you the other side of the story to what the legacy media typically does, which means this isn't our first journalistic rodeo with Planned Parenthood. Most of you are well familiar with the giant nonprofit organization with close to 600 locations worldwide and its focus on assisting women with abortions and creating sex education programs. But we've also kept many of you in the loop about shocking footage appearing to expose the nonprofit for the illegal sale of aborted baby body parts and other late-term abortion crimes, and then the intense vigor at which U.S. Vice President Kamala Harris, the then California Attorney General, launched the raiding of and seizure of that footage from the hands of the investigative journalist who released it.
We will celebrate the fact that we know how to fight. We will celebrate the fact that we are prepared to fight.
We've also showed you the public outcry in Canada and even state school changes to sexual education after Planned Parenthood presentations strayed far from the birds and the bees topic and straight into distributing alphabet-themed porn cards to children to ensure they're up to speed in their education on the latest in kink and S&M. And let's not forget the lawsuits started by Black Americans concerned about the parallels between Planned Parenthood founding eugenic roots and the organization's saturated presence in Black American neighborhoods and disproportionate amount of Black unborn babies being aborted. But hey, if a state and billionaire-backed nonprofit had some sort of eugenic-style depopulation for money agenda, surely they wouldn't be targeting the gays, queers, and trans community by rushing their young and vulnerable and gender-confused members into becoming lifelong medical transitioning patients who may even become sterilized from cross-sex hormones and thus have no chance of producing their own offspring, right? Nah, that's conspiracy theory talk. And to be clear, Jennifer Block, the journalist joining me in a moment, who has been covering gender medicine in the British Medicine Journal and recently wrote a piece for the Free Press about how Planned Parenthood has climbed to the top of providing testosterone and hormones for young adults who want to transition, doesn't want to be a part of this conspiracy theory talk. She wants to focus on the article that she wrote, and I'm happy to allow her and invite her to do so to keep you informed.
I have been covering gender medicine, youth gender medicine specifically for the BMJ for about 2 years now. And I had heard through several sources that, Planned Parenthood was known kind of on the street among young people as a place to go if you're 18, that, you can walk in and out with hormones. That was kind of the word on the street. And then in the last year, there have been a couple of other stories by reporters in the States with evidence of that as well. So I became interested in how Planned Parenthood came to be known as the place for testosterone, say, when I've historically done a lot of reporting on reproductive justice and abortion. And, I know Planned Parenthood as the place to go when you have an embarrassing infection or you need contraception or you need an abortion. I wanted to find out, just how large the scope is in terms of, how many locations. Planned Parenthood has almost 600 clinics around the country in the US and some in Canada. And what I learned from Planned Parenthood's own website is that at about 440 locations, give or take, gender affirming care, quote unquote, is available. And according to insurance claim data, which was provided to me by the Manhattan Institute, they obtained it. So these are payers. This is payer data only for insurance covered visits. Planned Parenthood appears to be the largest single provider of cross-sex hormones for young people under the age of 28. And that's new information. And since my stories come out, I've heard from, some Planned Parenthood supporters and donors who were pretty surprised at that.
Yeah, it is surprising. I mean, when I looked into it after reading your article, it looks like they started doing this in the odd clinic around 7 years ago, and now it's just sort of catapulted into this. And I think your article said the most prominent age group was 18 to 22, I believe. And someone who fits into that category is someone you interviewed. Her name is Christina Heinemann. Why don't you tell us a little bit about some of the issues or struggles that Christina had? She couldn't make this interview that led her to Planned Parenthood's doors, and then how quickly things unfolded after that.
Christina was coming of age around the time of COVID and the lockdowns in the US. So school stopped and she was stuck at home, stuck in her room, stuck online. And up until that point, she was doing okay. She was having some mental health issues. She was, learning about herself, figuring out that she's attracted to girls, going through a lot of the typical stresses of puberty and, growing up. But that all seemed to get really, really difficult during the COVID lockdown. She told me she pretty much spiraled into a depression, and she spent a lot of time on the internet. And she really came to question her gender as she explored her sexuality. She knew she was attracted to girls, and then she told me, she was reading so much on, she was looking at Instagram and Tumblr, and she started to think, well, I never, questioned whether I was a girl, but am I a girl? And that really led to her beginning to identify as, I think it was agender first, or non-binary, and then that led to trans. And by the time she was 17, she was absolutely convinced that she needed to get a mastectomy, and before that, she needed testosterone, and that this is what would relieve her of crippling depression and some, suicidal ideation. And that she told me those were the messages that she was getting, that, in order to feel better, she needed these things. And so she, her parents were skeptical. Her mom was very concerned about her taking, a drug that would perhaps cause irreversible changes. Her mother was absolutely opposed to her getting surgery. And so she waited until she was 18, made an appointment at Planned Parenthood, and in about 30 minutes had a prescription for testosterone.
We'll show the article when I read non-binary to agender to trans, all in a course of 1 year, and then going in at such a young age and coming out 30 minutes later. Now, I'm going to ask another question about what's happening now with Christina. But first, I just want to show there's more, or at least one more here. This is an example of Dr. Phil interviewing a young woman with a very similar story when she entered Planned Parenthood.
When you first started, you went in, you said, to Planned Parenthood.
Yes.
And they gave you testosterone immediately.
Yeah, I essentially just made a phone call and said, I want to transition. And it was immediately given. I got a prescription and went to pick it up like a week later.
Did they ask you questions? Did they do any psychological testing? Did they ask you why? What was your motive?
It was completely self-diagnosed. Well, self-diagnosed. I claimed that I had gender dysphoria and I wanted to transition, and they didn't really ask me any questions about it. I just called them and I said, when can I get this? And they just said they needed to write me a prescription for it and send it. And that's essentially
you
what
had
happened.
no proof that you were
I never
gender
saw a therapist about it.
You didn't.
Yeah, I didn't talk to anyone about it, nobody medically professionally. I had just looked up, I did some like trans research, I guess, into the transgender community and everybody online, and they just seemed so happy and successful. And at the time, I didn't see any information on detransition or any like the negatives about it. And so I kind of got completely wrapped into that.
What can you tell us now? My understanding is Christina identifies as a detransitioner now and is, taking some action for what happened.
Well, I met Christina because she's filed the first lawsuit against Planned Parenthood Federation of America. There's another plaintiff in another state who wanted to remain anonymous, and she's also filed a lawsuit just against the local clinic. But both of these women have very similar stories. Both, were the same age, same situation of being, stuck online in lockdown, attracted to women, coming of age, and both ended up at Planned Parenthood getting testosterone. But Christina had a mastectomy. She had a double mastectomy at age 19 after she was on testosterone for a year. And very quickly after the bandages came off, began to realize that this wasn't going to solve her mental health problems. And that now, in addition to what was going on before, she realized, she had, had a procedure that's irreversible, and, that it hadn't helped. And so she immediately, this was 6 weeks after her surgery, a day after her last appointment with the surgeon. And she decided not to do her scheduled testosterone injection. She put on one of her mother's dresses and went on her Instagram and posted that she was going by she, her pronouns again. And so she's, struggling to get back on her feet. She put off college. She put off college to transition. She spent her life savings on the mastectomy, so paid for that out of pocket. And so she's living at home and working at a convenience store where she wanted to point out to me that she sells cigarettes that she's not legally old enough to buy where she lives, even though she was able to do all this without, the surgeon also had one quick appointment with her before he scheduled the surgery.
Wow. Isn't that something for sure? And I don't know if we mentioned it, but Christina's also autistic. I've done an interview with other detransitioners who are autistic as well. And so there's definitely a pattern there. Well, thank you so much for being one of the very few journalists willing to inform the public about this situation. And we will be following the lawsuits closely. Is there anything else you think is important to add?
I did reach a former vice president of medical affairs who was at Planned Parenthood when the services began. She was part of the committee that wrote the initial guidelines. And when I first spoke with her, she said, I'm proud that we did that. We want to support people being who they are, and we want to support bodily autonomy. But when I shared with her how the guidelines have evolved to allow for these quick appointments, and when I told her about Christina and the other plaintiff and what they had gone through, she expressed a lot of concern. And she told me on the record that 30 minutes is not enough for these kind of treatments. These are powerful medications. And if people aren't fully informed and prepared, she said it could be a nightmare.
Like I said at Rebel News, we don't back down from bringing you the other side of the story. And unfortunately, when it comes to covering the other side of the story of the trans agenda, sometimes our journalists have been at risk in doing so. Nevertheless, we think it's important to keep the public informed. And if you agree, please consider going to our special website where we ask for your help to cover the costs for me to bring you reports like this when I'm in the field. It's called protectdrea.com. And my family and I appreciate your support.